Hello, today we will be dealing with the topic cellular adaptation under the topic cell injury. So we begin with what happens when the normal cell metabolism is disturbed. So in case of minor stress, there occurs adaptation, and if the stress is prolonged or if there is an injurious stimuli, then there occurs cell injury. And if it is mild and transient, it leads to a reversible cell injury. Whereas if the stress is severe and prolonged, then it leads to irreversible cell injury, resulting in cell death, either necrosis or apoptosis. So, adaptations refer to reversible changes in size, number, phenotype, metabolic state and function. So this occur in response to changes in the environment. So adaptation includes mainly 4 topics. One is hypertrophy, that is increase in the cell mass where the number remains the same. Next is hyperplasia, where there is increase in cell number. Then there is atrophy, that is decrease in cell mass. And finally, metaplasia, which means change in cell type from one cell to another. So first, we will be dealing with hypertrophy. So in hypertrophy, there occurs increase in cell size and there occurs the number remains the same. So in this case, the number remains the same and there is increase in cell size. The mechanism by which it occurs is increased production of intracellular structural proteins. And also associated with hypertrophy, a switch of contractile proteins occurs from the adult, fetal or neonatal, from the adult to the fetal or neonatal forms, which are better adapted to decreased energy requirements. So hypertrophy can be both physiological and as well as pathological. So examples of physiologic hypertrophy, one is during the pregnancy period when due to increased estrogenic stimulation, there occurs hypertrophy of the smooth muscle fibers of the uterus. And then in case of breast, in case of pregnancy and puberty, there occurs hyperplasia along with hypertrophy. And in case of the lactating breast, only hypertrophy occurs. Another example is skeletal muscle hypertrophy. In case of bodybuilders, when there is increased functional demand, there occurs skeletal muscle hypertrophy. And an example of pathological hypertrophy is in cases of hypertension, where there occurs cardiac hypertrophy. So this is an example of the normal uterus. And here what we see is the gravid uterus, removed in a case of postpartum hemorrhage. And so we can appreciate how in the gravid uterus there is hypertrophy. This is the microscopic view. Here is of the normal uterus showing smooth muscle, small spindle-shaped bland cells, whereas under the same magnification, the gravid uterus shows large plump cells. And this is a case of myocardial hypertrophy in a patient with hypertension, in which concentric left ventricular hypertrophy is seen in the cardiac myocytes. And one point to note is that in hypertrophy usually occurs in non-dividing cells, which non-dividing cells such as cardiac myocytes, which are not capable of dividing, and so they increase in cell size. The next one is hyperplasia. As we said, hypertrophy occurs in non-dividing cells, but hyperplasia in hyperplasia, there is increase in cell number. So, there is increase in cell number and it occurs usually in cells which are capable of dividing. The mechanism by which this occurs is growth factor driven proliferation of mature cells. Hyperplasia too can be either physiologic or pathological. Physiological, as we already said, due to hormonal stimulation, there occurs physiological hyperplasia in the breast tissue during puberty and pregnancy. So, along with hyperplasia, hypertrophy also occurs. And in case of liver, after partial hepatectomy, there may occur compensatory hyperplasia. And examples of pathological hyperplasia, one is endometrial hyperplasia, which can lead to a minor risk of cancer in later stages, especially so in atypical endometrial hyperplasia. And next is BPH, benign prostatic hyperplasia. Mind you that BPH is hyperplasia and not hypertrophy. That is a misnomer which used to be used earlier, but the correct terminology is benign prostatic hyperplasia. And the next is skin warts in response to papilloma virus. There occurs hyperplasia of the skin epithelium. So, after hypertrophy and hyperplasia, now we deal with atrophy. That is decrease in cell mass. So, this decrease in cell mass occurs in response to decreased metabolic demand, due to which there is decreased protein synthesis and increased protein degradation in the cells. So, atrophy too can be either physiologic or pathologic. Physiologic examples include during development of the notochord and the thyroglossal duct and other organs such as the thymus, they undergo spontaneous atrophy. And the uterus after parturition, that is after delivery, it undergoes spontaneous physiologic atrophy. The examples of pathologic atrophy include one, for example, in case of fracture of the limb, there occurs if there is immobilization in a plaster cast for a prolonged period, then it leads to disuse atrophy. And for example, if the nerve supply to a skeletal muscle is damaged, then there can occur denervation atrophy. And in case of brain in old age, if the blood supply is reduced, there may be a chance of senile atrophy. And in case of inadequate nutrition, such as in protein energy malnutrition or in cancer cachexia, there may occur atrophy due to inadequate nutrition. And pressure atrophy. This occurs due to enlarging benign mass. For example, in the brain, if there is a enlarging benign mass, it may compress the surrounding tissue and it leads to pathological atrophy. So, these two photos show brain tissue. One is that of a normal young patient. In both these halves, the meninges have been stripped off. This is that of a normal young patient in which the brain substance is normal. But here in old age, you can see there is loss of gyrae and widening of sulci, because of which is suggestive of loss of brain matter substance, which occurs in senile atrophy. So finally, we're dealing with metaplasia. Here what happens is, due to an adverse event, one differentiated cell type which is sensitive to the adverse event is replaced by another cell type which is more resistant to the adverse event. Though the replacement occurs, but metaplasia too is a reversible event, because if the adverse stimulus is removed, then the cells can revert back to normal. So the mechanism by which this occurs is reprogramming of stem cells or undifferentiated mesenchymal cells to be converted into the new cell type. The most common type of metaplasia is columnar to squamous metaplasia. One example is in habitual smokers within the respiratory tract, which is in the trachea and bronchi. It is usually lined with ciliated columnar epithelium. But in habitual smokers, due to the chronic irritation, this is replaced by stratified squamous epithelium. Another example is in excretory ducts of salivary gland, pancreas and bile duct due to the stones. The normal secretory epithelium is replaced by stratified squamous epithelium. And in case of vitamin A deficiency, because probably the tissue becomes more prone to free radical injury, so in the respiratory tract there occurs squamous metaplasia. Another type of metaplasia which can occur is squamous to columnar. This can occur in classically Barrett's esophagus. Barrett's esophagus, what happens is due to the high gastric acidity, the stratified squamous epithelium is converted to columnar epithelium in the lower esophagus. So nowadays in entrance exams, there is more of a trend for picture-based questions to be asked. So especially in pathology, you cannot ignore any of the pictures in the standard textbooks. So this is a recently asked question. Here you may be given a short history such as chronic smoker, and you have to identify the change which occurs. So in this case, here what we can see is columnar epithelium. Here you can see the cilia, and you can see the nuclei lying at various levels. So here you can see this is pseudo-stratified ciliated columnar epithelium, and as you go here it is being replaced by stratified squamous epithelium. So this is an example of section from the bronchus showing squamous metaplasia. And this is a section from the endocervix, in which here you can see the columnar epithelium, and here it is replaced by the stratified squamous epithelium. So in the endocervix also, due to the irritation, there can occur squamous metaplasia. So we end with a question. 72-year-old male complains of difficulty in urination associated with increased urge and frequency. On rectal examination, he has an enlarged prostate. Which of the following represents the most likely change in the bladder of this patient? The options are hypoplasia, atrophy, hypertrophy and metaplasia. So in such a question, you should not see 72-year-old male with increased micturition urge and enlarged prostate. You should not jump to the answer hypoplasia. Okay, I agree that the most likely diagnosis in this patient is benign prostatic hyperplasia. But that is not what they have asked in this question. What they have asked is the most likely change which occurs in the bladder of this patient. So what happens is, in a case with BPH, there occurs obstruction to urinary outflow. As a result of this obstruction, there occurs hypertrophy, smooth muscle hypertrophy within the bladder. So hypertrophy is the correct answer. So in today's class, we dealt with the adaptive cellular changes. So mainly we should know about the 4 types of adaptations, that is hypertrophy, hyperplasia, metaplasia and atrophy, and we should know definition of each and physiologic and pathologic examples in each of these. Thank you.